I'm going to do applying a fetal monitor, and then we're going to go to postpartum assessment. So the first thing I'm going to do, I'm applying the fetal monitor, is all my safety things. I'm going to go in, I'm going to provide for privacy, introduce myself, identify the patient with my double identifiers, wash my hands, and put on gloves. I'm going to educate the patient about what I'm doing. And so I'm going to take my toco transducer, and that is going to go at the apex of the uterus or the fundus. It's going to monitor contractions. So I would feel where the apex is, and I would secure it there. Usually you'd have a Velcro strap that goes around, but we're going to use some tape. Then I'm going to take my ultrasound, and I am going to use a lupo maneuver to make sure I feel for the baby's spine, and then I'm going to place the ultrasound where I can hear the loudest heart rate, and we want our baby's heart rate to be 110 to 160. I would wash my hands, and I'm going to look at my monitor. It should be running a strip to let us know what's going on with the baby and mom, and then we would take those strips to document what was happening. And so I'm done with that. I would make sure they're comfortable before I left. Next, we're going to do our postpartum assessment. So again, I would go in and do all my safety things. I would wash my hands, identify myself, identify the patient with 2 identifiers, provide for privacy, and I would put on gloves. I would explain to the patient what I'm doing. So, Ms. Jones, today we're going to do your postpartum assessment. Have you used the restroom, or do you need to go? She says that she's already gone. I'm going to go ahead and ask her about her bladder. I'm going to see if she's felt like distended, and I'll feel for that later, and ask her if she's had any pain with urination or any problems. She says no. And then I'm going to tell her I'm going to look at her breasts if she doesn't mind. She should be wearing a supportive bra, which she is. And I'm going to be looking for redness, ask her if she's had any pain, look and see if there's any cracks, bleeding. If she's bottle feeding, I would educate her on ways to prevent lactation. I'm also going to ask the mom that is breastfeeding if they're lactating okay. She says it's all fine. So next, I'm going to tell her I'm going to listen to her bowels and ask her if she's gone to the restroom, how often she has gone, if she's had any pain or any problems with that. She says no. So I'm going to listen to all 4 quadrants and make sure I hear bowel sounds, which we do. So that's good. I'm going to feel around and palpate and see if her bladder's distended. It's not. She said she just used the restroom, so that's fine. Next, I'm going to stabilize the uterus at the bottom here, and then I'm going to feel at the top of the uterus here, the fundus. And we're going to make sure that it's firm like a fist, and if it feels a little boggy, then we need to massage it so that way we can prevent our patient from hemorrhaging. So hers feels fine, and then we want it near or below the umbilicus, and so I'm going to measure with my finger where the top of her uterus is, or where her fundus is located, so that way we can document it later. So then after that, I'm going to ask Ms. Jones to roll on her side. I'm going to check her pad here that we've got. So I'm going to take it off from front to back, and we would put it on front to back. I'm going to look and see the lochia or bleeding. I'm going to look if there's any drainage or what it looks like, if there's any foul smell or anything that's out of the ordinary on the pad here. I'm also going to look at her episiotomy. I'm going to make sure that it's approximated, see if there's any redness, edema, drainage, odor. If there is some drainage, I'm going to document the type, amount, and color. And I'm going to ask her if she's had any pain or discomfort with that. She says everything's fine. I'm also going to look at her rectum to see if she has any hemorrhoids. If she does, I'm going to ask her about pain or any discomfort with that, and we would do interventions accordingly for her hemorrhoids. So after I've messed with her pad and I've changed my gloves, washed my hands, put on a new one, I'm going to wash my hands again, put on new gloves. I'm gonna next look at her legs. We're gonna see if there's any redness, edema. We wanna make sure that we don't have any blood clots or swelling in the legs. That all looks fine. So then we're gonna make sure our patient's comfortable. Ask her now if she's in any pain. If so, we would see if there's any interventions we could do for her. We would then monitor for her bonding with the baby and just see how the patient is interacting with the family and the baby. And we would document our findings, wash our hands, and provide for privacy.